You're listening to the Ridge Journal Podcast with Josh Lloyd.
All right. So I'm on with Nicki Groves, the first pediatrician in Black Mountain in a long time.
Yeah.
All right. So how much podcasting have you done?
Zero.
So I'm your first?
Yeah.
Okay, this is fun. I'm really happy to do this. For anyone watching, we've decided to move forward with a platform that really helps bring businesses to the area that are needed. And one of the first things that my wife and I felt was necessary to have in the area was a pediatrician. Now, I just put out like an all call for pediatricians, but there you were. It just seemed to line up.
I was already doing it. I was already in process.
Yeah, and so here we are. We have a great opportunity to kind of showcase what you do and let the community know about you.
Great.
I'm going to start with a few of our generic questions, and then we'll get into the meat of it.
Absolutely.
All right, so I want you to first tell me about your childhood. How did you come to realize who you were and what you wanted to be as a human being?
Ooh, all right. So the elevator speech is I am one of two kids. The oldest, my sister's 18 months younger. Grew up in the Midwest. I've lived in every state that starts with an I, except Idaho. So Illinois, Indiana, Iowa. Most of my childhood was Iowa, and then in a town of more pigs than people. Mm-hmm. So 5,000 people, one stoplight. And then I left for college and went up to Minneapolis, St. Paul. Okay. And went to the Twin Cities, and then was in the Twin Cities for 21 years before we moved down here.
And were you doing pediatric work there?
I did, yes. So I did college in the Twin Cities, and then I did medical school, and in between college and medical school is when I met my spouse. Okay. And so then after medical school, you do another series of years of training, and that's when I did my pediatric training. And
it's like 7 more years of training.
Yeah, so med school, so college plus med school plus residency, it's 11 years. So that's after high school. Yeah. Yeah. Yep. Yeah. So that's the short elevator speech.
Well, how did you come to find Black Mountain? It seems like far away from Minneapolis, St. Paul. How did you get here?
So it was a leap of faith.
Really?
Yep.
And this was with your husband?
This was with my husband. So
you have two daughters. Were they young at the time or even born?
We moved them here. I have twin girls, identical twin girls. They were 3 when we moved them here. So my husband is a dentist. And
would you like to give him a shout out real quick?
I will shout out to Dr. Mark Clive, who is in Black Mountain. Absolutely.
The one and only.
So he literally looked at me at an anniversary dinner and asked if I would ever consider leaving Minnesota. He has never lived anywhere else in his life. He spent his entire life in the state of Minnesota. Okay. And at this point, the girls were 2, almost 2.5. I had been in practice in Stillwater, Minnesota for 9 years. We'd owned his dental practice then for 11 years in Maplewood. We had absolutely no reason that we had to move. We'd just gone through the 9th snowiest winter on record. And he was looking for something different in the dental economy, rather than working on, predominantly insurance-dictated, single-tooth, fast, low-quality dentistry. He wanted to do something else. Okay. And so we started looking around, and people in a variety of different areas of our life said, you need to look at Asheville. I said, I'm not moving to the South.
You had your own, at that time, you probably had some biases.
I had never been here. So we came down for, literally it was 3 days. It was 72 hours, was it the end of October? No, it had to be November.
So is it still fall, like properly?
Yeah. It was beautiful fall. So we got to, we toured all over. We were on the Blue Ridge Parkway, wherever. We met with Tom and Scotty Cannon.
Okay.
So Dr. Tom owned the office before us. He started it.
Seems like they swooned you.
No, we had to actually convince them.
Really?
Tom looked at our stuff and saw that we had been in the Twin Cities for a long time. We were a dentist. We were a pediatrician. Mark had done advanced dental training and was teaching and was speaking. And he said, "You are not small town people." He said, I'm living in this community. Scotty and I are retiring in this community. We have built this practice. We invest in this community. Whoever's taken over this practice needs to know and value a small town.
Oh, man.
And Mark and I said,
it's a challenge.
Mark and I said, here's you're seeing us on paper. Mark grew up in a town of 2,500 people in a mining town in northern Minnesota. I grew up in a town of 5,000 people. My parents ran a small town office supply store. My grandfather was a small town pharmacist. Mark's dad was a welder. Mark's mom was a nurse. We do small towns. And so anyway, we fell in love with the area, and Tom was gracious to give us a chance.
How about those springs and summers, down here versus up there? I bet it gets warm in Minnesota in the summer.
It does. So Minnesota actually has extreme summers, so it's hot and humid in the summer.
Yeah.
So this is much, much more temperate. I don't ever bring out anything that's more than what I'd consider a fall jacket in the winter, and the summers are gorgeous. We love the climate year round, but what's more important is we love the community. Mm-hmm. This is a magical place to be.
In the 28711.
In the 28711, yes.
Yeah, so what did it take for you to acclimate to this area? It's one thing to say, we want this, we're moving here, but then the reality sets in and you had
We moved here with
kids.
2 3-year-olds and nobody.
Well, see, so let's pause for a second, because this is like the story that happens in Black Mountain all the time.
Yes.
Well, my wife and I moved here, then had kids, but it was right after.
Uh-huh.
And then a lot of our friends, our age, a lot of people our age travel like crazy when they're young.
Yeah.
And then they get pregnant and they're like, what do we do? We got to move somewhere and be close to family. And so many of them migrate here post haste after a child is born.
Yep.
And they try to find a way to niche into this community. And it's very common. It's a very common tale of people, new families starting over right here in Black Mountain.
Yeah.
So what was your story? How did it go?
So we landed, and Mark was actually here first. He started coming in March, and the girls and I moved down the beginning of July of 2011.
Okay.
And so he had already at least started working out places for us to live and rent. He had found a faith community that felt right and fit really well. And he was learning the neighborhood and learning the people. Mm-hmm. And so when we landed, it was summer, and I was in process of interviewing and being hired for a job. So I was a stay-at-home mom with the girls for 5 months while we transitioned in. So that got us a chance to play, explore the area, be at the parks, be at
the hiking. There's so much hiking.
They're 3-year old. Yeah. No. We were at the playground in Montreat. We were at the playground at, I have to call it Pond Tomahawk. I can't call it Lake Tomahawk because I'm from Minnesota.
They call it the pond at Tomahawk.
Because I'm from Minnesota.
The classic.
And so we were at the pools. We were all over. So the girls and I immediately got outside and explored, and we're all over engaging. And then the fall started, and they started at preschool, and so that then started to build even more of a social community that way.
That's really good.
Yeah.
We're going back in time again.
Okay.
What life experiences brought you into pediatrics? Because this is a specialized niche in healthcare, and a lot of people avoid it.
Yep.
And a lot of people are drawn to it. Why were you drawn to it?
It was not my intention when I went to medical school.
Yeah.
To do pediatrics. My background in college and in my time between college and med school is actually neuroscience.
Oh, wow.
I met Mark in the research lab. We were both studying peripheral pain pathways.
Okay.
So, So I was intending, first of all, when I applied to medical school, I applied MD, PhD. I planned on having a research and clinical career.
Sure.
And then the further I got into medical school, I did a little bit of research, but I let that go. I got into my clinical rotation. So your first 2 years of medical school are classroom, and then the second, the third, and fourth year you're in the hospitals and you're in the clinics. So I got into the rotations, and I went, okay, neuroscience, it's anesthesia, it's pain, it's neurology, it's, what do I do with that?
It's also fascinating.
Yeah, it's also fascinating. But the clinical medicine part was not right for me.
What was wrong about it?
Wasn't the right fit. It just was. It's not the day-to-day interaction of what that type of clinical medicine was. Just wasn't.
Were you feeling that in your gut, or was it more like a boredom?
No, it was my gut. It wasn't right. It wasn't right.
Yeah.
I went through, so there's a series of standard. You have to go through pediatrics, you have to go through adult medicine, you have to go through surgery, you have to go through
well-rounded.
I am not a procedure person. I am not a morning person.
Nice. Me either.
Yeah. So I went into my pediatric rotation. I was not expecting it much. I'm like, okay, I can do this. It's a month. I can do anything for a month. And I fell in love. It was the right people. It was the fact that a sick kid is amazing to take care of. You can be taking care of a kid who is riddled with cancer and bombed with chemotherapy, and they will have a squirt gun fight with you in the hall with glee. They
won't be so woe is me.
They take it, and all they need is somebody that's gonna help them find joy and advocate for them. They're so resilient.
And it's easy to find joy as a child.
And it's
easier, I guess.
Easier, yes. Yeah. And then the people that work in pediatrics, they're my people. The nature of somebody that works with kids is they're kind, they're open-hearted, they are an advocate. And that's, I went, oh my gosh, I get to help people learn to be a pediatrician. You are a teacher.
Yeah.
And I get to help not only this child develop into this independent adult, but I get to also help their parents develop on this journey.
And that was my next question. Like, when have you found yourself, and you don't need to name names, but when have you found yourself in a patient-doctor situation where you were really helping them understand the problem they were facing? Because that's scary for parents.
It's scary for parents. And everybody can have a perception on what level of problem that is, because a significant problem for one family may be insignificant to another family, depending on their background, their experiences.
Just like a cough that won't go away, or anything like that.
Right.
Is
so
just
a cough that won't go away, and then you can walk them through sort of, these are the things that I need to think about, and this is, or in today's day and age, what did you Google?
Yeah.
All right. What's on your holy cow? This is like what I'm worried about now.
What's ChatGPT telling you?
What's ChatGPT tell you?
Yeah.
What's your social media post tell you? And then my job is to walk you through on what the history and the exam of what I'm seeing doesn't fit with those things. And that's an interesting part of the last 10 years of practicing medicine.
Really? Because it's just gotten faster and easier to get information, good or bad.
Yes.
And a lot of people are doing their own research now.
And I wouldn't call that research, right? Research is you walk in with a hypothesis and you look at all different areas and you do not expect an outcome.
Well, not everyone's trained in that.
Exactly.
They don't understand how to hypothesize.
Exactly,
even.
Which is why it's really, really hard in the traditional current model of office visit with your physician or nurse practitioner or PA to walk out with an understanding, because it's a short visit, and to actually walk somebody through an evidence-based decision-making model of thought process on why we're thinking about this or this or this. That's not a short conversation.
Well, and that brings us to what makes you, in my opinion, not only special as a pediatrician, but maybe even elite, is you go to them.
Yes.
You show up to someone's home like the old way.
Yes.
With your stethoscope around your neck and your little bag.
I do.
Only you're not an old man. You're a beautiful, young, vibrant woman coming in to show them exactly what they need to do to help their child.
Yes. And not show them, coach them.
Coach them. That's right.
Yeah. I don't tell. I don't show. This is an interactive joint relationship.
But there's something that's sterilized when we are forced to go to the doctor's office that the doctor cannot see or witness. And it's what's happening in the home. Is there mold in the home? Is there, what's that smell? You know, what's going on with dad's shoes, right? Like, maybe he should throw those out. Like, there are things that, we might not realize that we're doing that are hurting our kids' health.
Right. The current business model for Sourwood Pediatrics, I have the privilege of being able to do home visits within the Swannanoa Valley, Black Mountain area.
Right.
Home visits are not in terms of time for the physician.
Right.
They're not efficient because I've got travel time and commuting time. And so that's limiting the number of people that I get to interact with in a day. And for me, that's okay.
Yeah.
If you're in a traditional health care setting, the payment method for that, which is in today's U.S. economy, is using insurance, health insurance as the payment method.
Yeah.
You can't do that type of work because you can't have enough encounters in a day to cover your costs.
Yeah. I mean, this feels like this is a first world problem we're facing as a community as a whole, and pediatricians are facing it dead on. How did you make that hurdle and say, you know what, this is okay, I'm just going to travel, or I'm going to have a few days a week where they come to me, but I'm going to go to them when they need me to? I mean, that was unheard of. I mean, 10 years ago, we didn't see that at all, I don't think.
So this is where historical perspective comes in. 30 years ago, 40 years ago, you were paying cash for your visits at your doctor's office.
Yeah.
Over the past 30 years, the trend in the United States...
We pay a copay.
Right. Is you aren't paying a copay. You are paying a health insurance premium and a copay. And you are allowing the insurance company to be the middle person between yourself and healthcare. That is not what healthcare was.
It feels icky.
A generation ago.
I don't like it.
It works for some people, and it is the system that is predominant in this country right now. It doesn't have to be that way, but it's what the current generation has learned is the norm or the way.
There's a lot of middlemen in the different places today in this age. I just recently went through a mediation with attorneys, and at the end of it, I just had a private conversation with our attorney, who might say what you want, but I was like, this feels really inefficient, and say what you want about ChatGPT, but we can get to the root number that we need to have for payout for damages really quick. Okay, and then it's like there's a lot of emotional baggage, there's a lot of damages that people are talking about, and then like the lawyers are being aggressive and intimidating, and like there's just no need for this anymore. So
there's not one way to do anything for most things, right? And so the model of business that Sourwood Pediatrics is called Direct Primary Care. And it is going back to the relationship is between the patient, family, and your physician.
Okay.
And it works like a gym membership. So you pay a monthly fee, and for that month you use the services of the office as much as you need or as little as you need that month. Now, insurance, if you go at the concept, like the root concept of insurance is designed to cover your rare, high-cost events. in general, right? Your auto insurance does not cover your oil changes.
Yeah.
Your home insurance does not cover your basic maintenance or if you have a plumbing leak. And so that is, again, 40, 50 years ago, what health insurance did. It covered your emergency room visits, your high-cost, catastrophic, rare things. And so direct primary care lets us come back to that model where for your day-to-day, 90-10 needs, 90% of your needs, you're interacting with your primary care physician. And if there is a need for the other rare things, we help facilitate in how to get that done.
Yeah, but for me, it's like that's a better way to utilize that monthly payment rather than it just going to an insurance and then they just coffer it. We're actually using it for when we need to see the doctor, and it's still the insurance. It's just now it's directly paid to you. It's not paid to some intermediate.
And if you tally up the amount of money in a year you spend on your office visit copays or your urgent care visits, again, by doing the direct primary care model, I'm seeing smaller numbers of kids a day, so I have more immediate access, which makes it much less likely that I'm going to say you need to go to urgent care. You're not going to call and say, "Oh, you can't see you for 2 days." That's not how this works. So it's a choice on how you want to spend your healthcare dollars. Yeah, it's an option.
For me, my big stick as I'm 43 now, and I'm male. I don't like going to the doctor. I don't like going to the dentist. I am one of many men who feels this way. My own father didn't like going to the doctor so much that he died at 63. And the week he died, he's like, I'll go next week. And he was just putting it off because he knew that it was going to cost him a lot of money just to see a doctor. And he knew he needed some stuff done. He had a replaced hip, And so a lot of men don't go to the doctor because of the cost of it, because of the fear of the cost. And then also, sad to say this, but since the 90s, there's been a lot of meddlesomeness in the field of healthcare where people are getting doctors are experimenting with their patients, it seems sometimes. They're doing things that are not necessary.
I don't think that, so I'm going to challenge you on that.
Please do.
All right. So.
But that's how men feel.
Yeah.
Yeah.
So again, depending on your interaction and what kind of services you're seeking.
Yeah.
If you are going in infrequently, so you actually don't have a relationship with the person that is trying to figure out what your needs are.
And that's a problem. You should have one.
But if you're infrequent and you're doing a traditional model where it means you have a 15-minute visit. Yeah. How is that care provider, whether a physician, a PA, a nurse practitioner, supposed to, their biggest fear is that they're going to miss something big. Yeah. And they've got 15 minutes with somebody that they don't know. And tough. So you're walking in and their job is to go, are you okay? Are you sick? Are you sick and we need to actually, but I'm not sure what's going on, or are you scary sick and there's something big? Yeah. That's what they've got to do in that 15 minutes.
And so it's like pan and scan.
Because they can't miss something.
They're real quick, but they still do miss sometimes.
Yeah, but how are they not?
Yeah.
You're not giving them a chance.
Yeah. I appreciate you advocating for the doctor in this experiment. Well, because it's tough because the doctors get a lot of grief.
You have to look at both sides. And, okay, and again, doctors, PAs, nurse practitioners, because if you're going into primary care, you're not necessarily seeing a physician. Yeah. All right. And the business model is not dictated by your care provider. That 15-minute visit is not the doctor or the PA or the nurse practitioner making that decision. It is your health insurance company deciding that's the value. It is not the care provider. It is the business system. And that's what the American people have to wrap their head around. And so what business system do you as a consumer want to support for your health care?
Yeah, well, it sounds like a tall hill to climb for the layman. How do we change it? How do we make it better for everybody?
So you, first of all, is become an informed consumer.
Yeah.
And that's hard.
Very hard.
Very hard.
There's a lot of misinformation on the internet.
The internet is mostly misinformation, and it's all algorithmic. So the more that you search the same question, the more it sends you down a rabbit hole.
No, well, like it'll hear my daughter coughing, and it might even hear a conversation about my wife and I talking about said cough, and then like my social media posts are a bunch of like, put onions on their feet, do this, do that, and it's like I'm not even asking like my phone.
Right.
It's telling me through algorithm, it's sharing pages with me for like home meds and like different types of like herbal care.
And all of that is based. So first of all, there's no quality control or vetting of what type of that information ends out there. And so you have no idea when that feed's coming to you. Is there any truth or any research or any evidence behind it? It's just algorithmic based on this is getting interest and hits. And the more that somebody is like, I'm curious about that, the more it's going to pop up to the front of your feed.
Well, I don't know why I'm bringing this up, but I remember Steve Jobs was on his deathbed, and his last words of advice were, "Don't take Chinese medicine. Go the route of American or Western medicine instead." Because apparently he spent like the first 3 years of his cancer trying to do the Chinese medicine stuff, and then he found out too late that he should have been doing the Westernized medicine the whole time.
There isn't. So I think there is a balance of types of interventions, treatments, therapies, support that can come from lots and lots of different areas.
Right.
I think the tricky part, which is why I have 11 years of training after high school, is to determine what stuff has the true evidence to say that is the reasonable thing to do for this situation.
Yeah.
And to do that, it requires an understanding of statistics and research, right? And in combination with an understanding of physiology and what's different for a 2-year-old versus a 20-year-old, because they're not the same.
Yeah.
It's an understanding of public health, both in your local community and the global nature, because we are now a global community. And so it's all of that wrapped into one, and you cannot get that off of a ChatGPT search.
No, you can't. I don't want to go on a tangent, but I want to bring something to the surface that I think you can glean light on. There's been a lot of talk recently about antiparasitic medications helping with cancer treatments. Have you heard anything about this?
That is not in my wheelhouse, man, because I am a general pediatrician. Yep. And that's I'm also going to be really clear about I'm a general pediatrician, what's in my wheelhouse and what's outside my wheelhouse.
You've had to have come across a child with cancer at this point in your career. Am I correct?
Several, yes. But I am not the oncologist.
Yeah, what's your role in that treatment with that child?
My role, occasionally, I'm the one making the diagnosis.
Yeah.
And that's really hard.
I bet.
That's really hard.
You have to be the one who says what's actually happening. That's hard.
Try being a physician, and you're in 15 to 20-minute visits in a day, and you've got a kid that meets the criteria, and you get their blood work back, and you're like, okay, we've got leukemia, or you're a type 1 diabetic, and I have to talk to that family while I've got other people waiting for me, break some life-altering news.
Yeah, I can imagine.
And immediately arrange for that next level of care for the kid.
Yeah.
So when you're in the office and you're going, what is taking so time? Please think about the fact that it may not just be a simple thing that your provider has just walked out of. And then I need to turn around and be present for that next visit where it's a 3-year-old with a temper tantrum.
Yeah. My kid.
Yeah. And I just walked out of somebody who I told their family their kid's got cancer or their kid's got diabetes. And I need to be present and emotionally available for you and what's happening with your 3-year-old.
How do you change gears like that?
You don't have a choice. It's the job.
Yeah.
Yeah, it's the job.
Man.
It's not a job. it's a calling. It's not a job.
Well, that's what they say about a lot of things these days. With your own children,
Yeah.
when did you ever find yourself like really having to tend to care for them and seeing them sick? Did you ever have these moments with them? And what goes through your mind?
And what goes through your
as a
mind?
mother and also a pediatrician?
Yep. So we so far, our girls are not quite 18, and so far have had pretty minimal health needs for the kids. Neither one of my kids have significant chronic diseases. Neither
Great
one of
genetics.
them. I don't know. It's hodgepodge genetics, sure. So I have gotten to experience, how to behaviorally manage identical twins through the toddler period who are also fiercely independent. I describe my kids as there's a higher power that knew it was too much personality for one individual. I split it into two.
Yeah, crack that egg.
that is my kids. So I got to practice what I preach in terms of how do you help raise somebody who can be independent and autonomous and self-assured and safety aware and respectful of others. That's what I got to experience with my kids.
The big fear for me is the safety aware.
Yeah.
And I was ballsy's not the right term, but I would take risks. And I was a boy, okay. But my daughter, my oldest, she's such a tomboy, and I see her doing the same stuff I used to. And her grades are identical to mine. It's like 80, 80, 83, 80. I'm like, oh, get them up, get your grades up. But she looks just like me on paper, and it scares me because, and then once they get to be older, the risk awareness is more like about relationships, and not getting into a predatory relationship with a male.
Yes.
The girlfriend stuff, like when they get in their cliques, and I've already seen it happening with her friends. Eris is very bright as a light, and the girls are intimidated by it. And they'll click off and they'll exclude her because if she's there, then she kind of runs the show. She talks a lot, and they don't want her in the room with them. And they just want to play together. They don't want to play with Eris. And it's like, oh, come on, But it happens. How do we get them to understand that dynamic? And
so you don't get them
to help them, right?
Thank you.
How do we help them? Thanks for the language. I need that.
Keep your kids off screens and don't give them a cell phone.
How do you take it away from them?
Don't start it.
It's too late. What do I do?
So if you've already started it, so this is where you start to put boundaries. And so where there's time limits. And
we've got the 30 minutes.
Yep. And you, as a parent, also have to model the behavior you want.
That's the hard part. Look around you.
So
I'm completely consumed by tech in here.
So you have to model the behavior you want, and you have to identify opportunities to be present, face to face, interacting without the noise.
Well, we were having a real hard time, and she was throwing fits whenever we'd take it away, and so I went out of my way to get a really nice chessboard, and we played chess for 3 months. And that really sort of helped soften the blow when we took the phone away, because it was something she could do with me.
Right.
And,
people are craving interaction.
Yeah.
And
great correlation there. I think that might be what that was.
They're craving interaction, right? And
with us, their parents.
With their parents. And if you give a child an consistent opportunity to have face-to-face interpersonal reactions, and they know they can start counting on it, you're going to see that demand for screen is going to go away.
I think you might be right about that. It's been tough, I tell you, and then also the hard part for us is just keeping I don't mean to say it this way, but keeping the demons at bay when it comes to like television and like the stuff that they see just on the TV's not even playing anything. It's just scrolling through the marquee of things to watch. And it's like, get the freaking demon off the screen.
Just turn it off.
You got to. You don't have a choice.
Just turn
because
it
if you
off.
leave it on, they're going to see these awful images,
Right.
zombies, and like, it's like,
And it is facilitating an incredible, just like underlying baseline anxiety. And so if you need distraction on in the background, turn some classical music on.
I do that.
Yeah.
I also, if we do have the TV on, I put it on like cityscapes or something. And so like, that's just like aerial flying through cities
Yes.
or something like that.
Yeah. But recognize that there are generations of people that have done really, really well for themselves without having a screen on all the time.
It becomes a problem. So let's talk about the adolescents that you see. When they get into 11, 12, 13, 14, 15, does anyone come to you with like a problem they're facing, but then you realize it is simply underlying anxiety that's the issue?
All the time. All the time.
And I can't imagine you're the one that's quick to throw a medication in their face. No. What do you do instead?
So first of all, even if my instinct is the underlying problem is anxiety, that's a really hard thing for the teenager and the parent to hear as this
psychological.
as this is the reason.
They want to point to an illness or
my
ADHD.
They want everything else excluded. They want so when they're having significant belly pain that's disrupting sleep and they can't go to school.
That's been happening to us.
Me telling them this is probably anxiety. That can be part of the conversation, but if I say this is anxiety and I don't acknowledge all the 17 other things that they're thinking about or they Googled or whatnot, then we got a problem.
Yeah.
I might be right. And then my job is to balance, right? Not missing something.
Yeah.
Also not doing harm. How much testing, how much laboratory stuff, how much imaging, how much specialty stuff do I need to refer to for something that's anxiety? And how do you facilitate that understanding and conversation? And you have to have trust to do that.
And they have to trust you.
Yeah.
Right.
Right. And they have to trust me and they have to be willing. It is a two-way street.
I have a funny vision in my head of who was the woman who did the research on the gorillas in Africa? She just passed away.
Jane Goodall.
So it's kind of like you're Jane Goodall going into the home of the gorilla family, and you have to sit on the outside for a while, and then you have to sit, and it takes weeks, if not months, and then finally you find yourself in the middle of them, and then they trust you, right?
Right.
It takes that long. I mean, what's the process like of getting a family to for you to earn their trust?
It depends on the family. Every family's different because their background's different and their trauma history is different. And so it depends on the family. Yeah. If I've got a medical family walking in where, the parent's a physician, the whatever, it's a very different conversation than if I have a family coming in that's had significant trauma in their past or bad outcomes or has an 8th grade education. Like, they are different. Very. Yeah.
And then post Helene, I bet there were some people who were in that situation who are really bad off that you had to see.
There's a whole different set of questions and check-ins coming out of Helene.
Yeah. How did that affect your practice?
So during Helene, I was still working in a general pediatric practice in Hendersonville. Okay. And so the facility wasn't shut down for very long. We got back open pretty quick, but because I live here in Black Mountain, and there were fuel shortages and gas shortages, and I had partners that lived 10 minutes away, not 45 minutes away.
Yeah.
There was a while where I worked remotely. I did some telehealth visits that I could. I helped manage inboxes with phone calls and prescription refills and that kind of stuff. But I didn't actually go back into the clinic for a few weeks.
Yeah.
We were also, at that time, I was helping Mark. We were, getting the dental practice back open. He was the first dental practice open in the area because we figured out how to get water. We stowed our kids with a dear family friend in Fayetteville for a couple of weeks because we knew that we needed to be able to be here and present and activating for the needs of the community. And the girls would have absolutely been fantastic helps, but I didn't know what kind of food we were going to have. I didn't know what kind of water. I needed them to be safe so we could focus on what needed to be done here. And the girls understood that.
That was a real slog, that first 90 days of the storm. I mean, we took our kids down to Concord. They stayed with my wife's parents for about, I don't know, maybe 10 days.
Yeah. And that was really hard. But the girls, they got it. Again, somehow we ended up with insightful, empathetic kids.
Yeah. Would you my kids always did this happen to you when you were a kid, Dad? Mm-hmm. Were you getting a lot of that, and were you giving them that feedback, where you talk about something that happened when you were a child?
So,
I think that's how you grow empathy.
I think that's how you grow empathy.
In part.
Our girls know we're really good about connecting with our families, and Mark's mom still lives in the house that he moved into when he was 5 months old, and his family's up there. And so when we go home to Grandma's house, they're walking into, a tiny story-and-a-half house out in the fields in northern Minnesota, with a bathroom that you can sit on the toilet, wash your hands in the sink, and put your feet in the tub all at the same time. And so they witness every time we go home what Mark's childhood was like and how he grew up. And my family has all exited Iowa, so what they have is the stories for us. Yeah,
we still have the farmhouse in Kansas. My wife's mom, she grew up. She was basically born in that house, and it was literally the shed behind the house they built. But they bought the house in a JCPenney catalog.
Yes,
and they brought it and dropped it right there.
Yep.
And it was a big house actually.
Yeah.
The one they bought.
Yeah.
And so it's you can't do that anymore.
No. Well, you can actually. Amazon's selling kit houses now.
Oh, right.
And
they're not like that house.
They're not, and they're 3D printed houses now too. But no, nothing like the Sears house and the catalog houses. So back to the girls know our stories. They know that that both Mark and I grew up with limited resources and wearing clothes our moms made or secondhand clothes, or they are very, very well aware that the childhood that they've had is very different than the childhood that I had or Mark had in terms of resources and comfort. The family love is there and connection is there and the emotions are there, but the physical nature and the environment is very different.
Very different.
Yeah.
I'm going to pull questions.
Okay.
And before we go any further, are there any questions that you really want me to ask?
Yeah, actually there is.
We get off on tangents in here.
So the stories, what was the most challenging aspect of your life to this point?
You like that question?
I do like that question because I think a lot of people are going to expect me to say something about getting into medical school or going through training.
Yeah.
I'm not.
What are you going to say?
I'm going to say
ahead, answer it.
It was getting pregnant and staying pregnant.
Really?
Yep. That is the most challenging part of my life and Mark's life.
Forgive me for asking if it's too close.
I will be open about this.
Did you lose a child?
2.
You lost 2.
I lost 2.
And were they twins then?
Nope.
Okay.
Nope. We started. We intentionally didn't want to become parents when I was in residency because I was working. This was before work hour restrictions, so I was working 110 hours a week.
Yikes!
For 3 years. So that was not the right time to become a parent.
So you lost 2 kids.
And
then you had twins?
I So I lost 2 pregnancies. The second one, we started with some medical assistance. Then after lost the second one, needed more medical assistance and ended up having to do IVF. Choosing to do IVF. First round didn't take. The second implantation round, we had 1 embryo left.
Wow.
And I got twins. We got twins. Yep.
You know, this happened to my friend John Seaman, and it's so weird. It's like they lost a child, and then his wife had twins, and we like to think that the child he lost came back through, but we don't know. You can't prove it.
Right.
But like the 2 you lost could be the twins you have.
No. No. So I have.
At least the soul's filled the bucket again.
The soul's filled the bucket. Yeah, exactly.
Yeah.
But that's and being a pediatrician when you're having a hard time becoming a parent.
I bet that's tough.
And actively miscarrying while you're in the room taking care of a family who didn't have any challenge at all of becoming parents. That's really tough.
Yeah.
Yeah. But it makes me a stronger person, and it makes you more empathetic, and it also makes you just not judge.
Yeah. I mean, like, what did it take for you to get over the hurdle there? I mean, how did you mentally escape that anguish?
The first one, I think.
Was that shocking for you the first time?
Yeah, absolutely.
I can imagine.
Yeah, for both of us. Yeah. First one, I had to take I stopped work for a little bit, and then I had 2 months where I couldn't see newborns. I just couldn't do it. My partners were great about that. Second one, I had a dog. We had a dog. So between the first one and the second one, we got a dog.
Okay, yeah.
So we were at least dog parents.
Yeah.
But same thing with the second one, the second loss, same thing. I had to take just, a couple of weeks off and had to not see newborns for a little bit. And then,
we almost lost both our kids. I don't know if I told you those stories.
Yeah.
I'm not going to get too in detail, but in the 7th month with Eris, we wake up at 2 a.m. and Eris or Andrea is just bleeding out all over the bathroom. We thought we were losing her.
Yeah.
And we were able to save it, but it was a placental tear.
Yep. Those are terrifying.
Yeah.
And if you are here in the mountains of Western North Carolina, there are not a lot of, you can have some significant transport times to get to a facility that can care for you.
Yeah, well, luckily for us, and this is another benefit to living in Black Mountain, is it's a straight shot to Mission from here. And at 2 a.m, there is no traffic. Yes. And so we got her there in ample time, and everything was okay. But when Helena came, we had COVID complications. We had what's called COVID placenta. I told you about that, I think, a bit.
Yeah.
And it's just like scabs all over the placenta. As like, I'm a car guy, air filter, gas filter. If you got clots all over it, you're not going to get the nutrients you need. And we had to have emergency surgery right after she was born. And it was touch and go for 78 days in the NICU. Yeah. And so we got really lucky. But, those experiences have made my wife not want a third. Yeah. And
you have to validate that. Right? There's another question about fear. Right?
Go ahead, yeah. Read it. What's it say?
Okay, so
I'm a little rusty.
So your question is, how do you manage yourself in a situation that requires no fear?
Yeah.
So my response to that is, there's a difference between no fear, which isn't safe.
Right.
It's not safe. And
it's negligent, really.
Acceptance of fear, but refusal to let fear stand in your way of doing what is right and needed.
Yes.
So I'm constantly afraid of missing something or making a mistake.
Well, it's your job.
It's my job, right?
Yeah.
But I can't let that fear stop me from providing the best care I can.
Because that's a fear also, is they won't get the care they need.
Right, exactly. So I have to acknowledge and respect the fear, but I can't let it paralyze me.
No.
Yeah.
That's tough.
Yeah.
Yeah. moving away from fear,
Yeah.
I want to ask you, when in this occupation, or even just in general in your life, when do you find the most joy? Like, what situations bring joy to you?
Ooh, yeah. Okay. So there's a lot.
bet.
I love what I do. So one set of joy is just the relationship with people. And when you've had a family that you've worked with and they're on their second kid or their first kid or the third kid. The first kid, they've got the list, right? They walk in and here's your list of questions. And the second kid, they've still got a list. And they're going, this is different. The first kid didn't do that.
Yeah.
And you're going, yes, it's a different kid. It is not the same.
At all.
And the third kid or the fourth kid, they go in, they're like, Doc, we're good.
Yeah.
We're fine. I love that.
Uh-huh.
I love that.
I want that, but I'll never get it.
Yeah.
Having that kind of ease with, like,
Yeah.
you know.
So that I love. I also love working with, again, it's also the relations with the kids. And so you start working with a kid when they're a newborn or whatnot. Oh my gosh, the kindergarten send off, when you've got this kid that you've taken care of, and now they're going to kindergarten and they're this person and their parent sits in the corner and your whole visit is just with the kid. It's awesome. So awesome. And they're comfortable and they're happy and they're excited to talk to you and they share all kinds of stuff that their parent is face-palming about.
Yeah.
And it just it's a highlight of a day. The other things that I find joy for is doing hard stuff. I have a passion for taking care of super complicated kids whose just their genetics or whatever just got a little haywire and there's stuff that works differently in their body and they need special care. And boy, it is so rewarding to being able to help and advocate and get the care those kids need. And part of the reason of moving into direct primary care is so I can have the time to get those cares, because you cannot get the prior authorizations or the DME paperwork or all those other things to get the wraparound supports that those kids need. You can't get that done in a 15-minute office visit. That is outside of your paid clinical time.
How much time do you need with someone like that?
It depends on the kid. I've had a kid who had a rare medical condition and wasn't able to get care in the state, and it took me 90 hours to get the kid approved for out-of-state care, and probably 6 months.
What's that process like?
It's a lot of phone calls, it's a lot of documentation, it's a lot of letters, and it's a lot of follow-up.
And like, what states are better at acclimating for a child like that? I mean, I don't understand why you couldn't get that care in this state or another state. Like, what? If
you've got something that is a 1 in 100,000, you're only going to have a few places in the country that have the right care team that understands how to do that type of therapy or interventions to help that kid. You shouldn't have that resource everywhere.
Yeah.
Because then it's not going to be done well.
I see.
Yeah. Yeah. And people don't realize that Western North Carolina is rural. So in terms of what we can offer you here for healthcare, particularly for pediatric specialty healthcare, we do a lot, but we can't do everything. And you don't want us to do everything, because to do it well, you need to see it a lot. I'm going to ask this question in 2 parts. Yeah.
And you probably saw this one. You may not want me to ask it, I don't know. But how did your industry, specifically pediatrics, adapt to change during 2020 and COVID?
Oh, yeah.
And how did you adapt as well? But then also, I feel like post-2024, we're actually coming back into we're adapting again, it feels like. We're coming back into a new way of it. We know a lot more now. I think, than we did in 2019 about COVID and all of that.
Which you should, because when something is new and novel, you don't know anything about it.
SARS-CoV-2, like we know a lot more now about it.
That's the whole point. Like if something is brand new, you don't have any historical reference for it.
Yeah.
You don't know anything about it. And so in terms of how did our industry adapt in 2020? Telehealth.
Big time.
And oh my goodness, if there was one gift, because primary care and medical care have been advocating for telehealth for years.
It really shook up the whole industry, didn't it?
For years, but we wouldn't get paid for it. We wouldn't get it. It wasn't a paid service. You got paid for having people in the office,
and the patients really hated that.
Yes.
Because we didn't, like, when you have a sick kid, you do not want to cart that kid across the county to go see their doctor.
And there's times that you need to. Like, I can't listen to lungs.
Yeah. Through the internet.
You know,
at least not
there's
yet.
ways of doing it. There's ways of doing it, but it's not good.
Yeah.
So there's times where I need to see you in person. There's times I need to lay my hands on you. I need to feel that belly and make sure there's not a mass in there. I need to listen to those lungs. I need to go, oh my gosh, do you have a heart murmur? There's stuff that I need to see you in person for. But the being able to actually utilize telehealth as the tool it is, has been great. Now, unfortunately, there are restrictions coming back in on that. They're starting to the push, just like there's a push in return to office for work. The push is return to clinic for care, and if you are relying on your health insurance to pay for your care.
Well, and a lot of people are, but a lot of people are migrating away from that model.
Yeah, and there's going to be some interesting choices coming up this next year with the if you're on an employer-based plan or on the marketplace, there's going to be some interesting choices on and difficult decisions on how you're accessing and paying for care.
Well, again, I don't even want to bring this up, but I feel like I have to. Like, how is Obamacare fitting in all of this now? And is it even still there? Do we even still have Obamacare?
So it's the Affordable Care Act.
Okay. And tell me what's going on with
that. And
how does that affect you?
So we were, when I transitioned employment, we are now on the marketplace, so accessing family health care through the Affordable Care Act. Our premiums for our family are scheduled to go up over $1,000 in 2026.
And is this problematic for you as a pediatrician?
Yeah, absolutely.
Okay.
Absolutely it is. And so I look at the amount of money that for a low healthcare utilizing family, going to pay out just as a risk mitigation for a year, and I go, oh my gosh. So is there an alternative and in terms of protecting us from catastrophic stuff and doing old school self-pay for the stuff that's our regular day-to-day expenses?
I mean, I don't really know. Maybe I'm just out of the loop because I don't go to the doctor enough, but I haven't seen a model lately, at least in Buncombe County, that isn't on the same model you're on now. I mean, we've got Lantern Health, we've got Wes, and the guys over at Jane Jacobs.
Yep.
Like, they're all on the same model you're on now. It seems to be really trending.
So Asheville, the Asheville area, I think, is ahead of the curve for direct primary care offices. There's probably 10 of them for adult medicine.
Yeah.
I don't know if that's just because you've got a different understanding or education of the healthcare consumer in this area.
I can tell you, I don't have much of an education at all.
Or the physicians have, again, made an intentional choice to go, I love being a physician and taking care of patients, and I can't do that well in an insurance dictated payment model. So how can I do this? And the direct primary care model of care has actually been around for, there's practices in the country that have been doing it for over 15 years.
But then, I mean, there was
Yeah.
a time before when that had to be the model back in the like 40s and 50s.
It was. It
that had to
was.
be the model.
It was the model. Yeah.
The doctor comes and visits, and he charges you $30 or something.
Right. Yeah.
And he goes on his way. And $30 back then might as well have been $300.
Yeah. Yeah. Or you're bartering.
Yeah.
Which used to be the case as well.
Well, I told you my
Yeah.
grandfather was a pharmacist
Yeah.
in Bryson City, and he would take the Native American blankets and he would give them their medications. And we had stacks of blankets we didn't need.
Right.
Probably dozens.
So there are opportunities, and in terms of everybody's got their own thing that's right for them. I got frustrated of not being able to give families the time they need and the care they deserve without spending a lot of time on what was supposed to be my day off, my self-care time. And so this allows me to actually give people the time they need, and that feels really good.
Well, how do you take care of yourself?
So,
What's self-care look like
self-care
for you?
for me? Self-care for me is being able to walk. I'm a walker. I'm not a runner. I'm a walker.
So my problem is
Yeah.
like
Yeah.
I'm a photographer, but no one ever takes pictures of me.
Yeah.
Right? You're a doctor,
Yeah.
but do people take care of you? Because it seems
yeah.
like you be in a situation like me where like no one gets a picture of me ever.
So I'm actually really good about making sure that my routine and preventative healthcare needs are met. Like my care team laughs because I walk into the room and I hand them a sheet of paper that says, here's my last mammogram, here's when I did this, here's when I did this, here's my list of vitamins or medications, here's my up-to-date immunization history, here's my care team, like this is my dermatologist, this is
Love
whatnot,
it.
and they just laugh.
Yeah.
But I love that when somebody walks into me and they're like, I own my healthcare. Here.
Well, and nowadays, especially with women's health, I mean, that's a huge thing that I think a lot of women entering into their perimenopause phase is, they're having to like really kind of like speed up the learning process to understand what's happening because we live in a new era now with what they call it HRT and hormone replacement therapy, and we can actually extend the livelihood of our lives another 2 decades if we're careful.
And there's a whole there's women's health research historically has not been funded well, and there's a significant movement now to improve that.
Yeah.
When you look at the percentage of the population and the age of the population that is affecting, again, I'm in there, so I'm a little biased, but we deserve it.
Yeah, of course.
Yeah.
And I think maybe part of living up here, we might be privy to some stuff that people down in the low country might not be yet, as far as like how we take care of ourselves in later age. Black Mountain, Asheville, we're very progressive here.
Yes. Yeah.
And especially when it comes to healthcare, I feel like, even though we have our problems with mission and whatever, but like overall, the overarching vibe I get is that a lot of people are very health conscious in Buncombe County, whereas in other parts of the state, maybe not so much. You see it in pockets of urban, like Charlotte, Greensboro, even Raleigh, definitely. Very healthy people in Raleigh.
I think people, everybody's got a different definition of what healthy means for them. They do, right? Everybody's got a different definition. And so you can have a medical definition but you also can have other people where if their family history is everybody's dead by the time they're 40 and they're now 53, they're feeling pretty good about how they're taking care of themselves.
Yeah,
right?
I can see that. If I get past 63, I'll feel pretty good about it.
Right. So everybody's got a different version of it. They've got different priorities. And so it's not...
The healthy eating movement in Asheville is very strong.
It is, but it's also really expensive.
Very expensive.
And so when you look at 1 in 4 kids in Buncombe County are food insecure, you also have to be really careful about how you're delivering messages about healthy eating when you also have access issues. Right?
Yeah.
Because you can't put that guilt on a family. You can't make them go, I have to buy the organic food, but I can't buy this because I don't have,
I just flashed to the Grinch meal advertisement I saw at McDonald's.
Yeah.
It's like, I can't wait to go get it. But it's like, that's just not healthy. But, a lot of people eat that way every day.
Because when you look at the cost of food and the access to food, and the difference between being hungry, there's hard choices.
Well, one hard choice I made, I just started eating beets.
Yeah. Okay.
And it's been good for me.
Good.
Yeah. How do you get a kid to eat healthy? This is a problem.
Oh, yeah.
I'm asking you this for me. This is for me and my wife.
Yeah.
My daughter won't eat anything. She won't eat anything but bread, and I can't get her to. Never mind a beet. I can't get her to touch cheese. I can't get her to eat chicken.
Yeah.
What do we do? How do you just force it down her throat?
No.
How do you Miyagi them into eating?
So you model.
Well, we do that.
Yeah, I know, but statistically, if you've got a kid who's a picky eater, one of their parents is a picky eater or has been picky eater.
When I was her age, I was a rail, and I wouldn't touch a thing.
And what age did your eating habits change?
When I was playing football, 15, and I became, I wouldn't stop eating then.
Yeah.
And I ate everything.
Yeah.
And I became a sugar hound, and I would drink orange juice gonk, gonk, gonk. Orange juice has been proven to not be healthy for you now, but I would put it down like it was back then.
So you have to recognize when you've got a kid who's got what seems like a restrictive or controlling behavior.
Yeah.
And whether it's, they're constipated, they won't poop, they're picky eating, they've got, whatever they've got. It's your thought process needs to go around what's underlying the control need. Not necessarily focus exclusively on the behavior, but why is that need for control there? What's underneath it?
Yeah.
That's where your thought process needs to go. So if you've got a super, super picky kid, the question is not, how do I get them to not be picky? It's, what's this about? Why is it there? Did they have a bad experience with food? Did they choke on something? Do they actually have some kind of food intolerance and they get a bellyache every time and they don't have the words to tell you about that? Is there something else going on in their environment and the only thing they have control over is what they put in their mouth? There's a lot that goes underneath there, and you cannot force a kid to eat. Just like you cannot force a kid to poop. You can't. And
poop, damn it.
You cannot. They will win that battle.
Yeah.
And so the more you can take the conflict and the battle away and instead support the kid through the underlying what's the process around this, you're going to get a better outcome.
All right. So the first question you said you wanted me to ask you.
So there was a question in here about, where did it go? When do you cry?
Okay, yeah, here we go. So when do you cry?
So most recently, and it caught me by surprise, I was in church on a Sunday, and I was watching the little kids, and there's a handful of kids there, and they're happy, and they're socializing, and they're playing, and I had just sent my girls off to college.
Oh, man.
And I teared up because I was looking at that joy, and I was going, that energy is not daily in my house anymore. So I teared up. I was at this past Saturday, I was at a martial arts testing. I was an event sponsor for it.
Oh, that's right.
And
I was there.
There was a 9-year-old, almost 10-year-old boy giving a speech in front of 200 people.
Little blonde boy.
About his, as he's competing for his, not competing, he's testing for and achieved his black belt. And he was amazing.
Yeah.
He was engaged. He was funny. He was articulate. It was amazing. And I got tears in my eyes because I'm watching this amazing human being up there.
What a community they have over there. It's quite something.
Sun Tzu is something. Yeah, it's something. Yeah, it was a gift to my daughter to go through that practice. Yeah.
So, regarding your kids, and you don't have that. You said you don't have that energy in your life anymore. One thing that I'm struggling with, because my kids are still young and they're in the house, is when they do leave, there is a period of time when they leave the nest. But then, like I did, I migrated back close to home. Do you think you'll ever have that energy close to you again like that with grandchildren? Do you think that, because I feel like there was something that was kind of like spilled out to my generation that might have been false. The idea that you have to leave home, you have to go far away, and you have to stay far away. You have to separate yourself from your unit, your family. Like, I thought I had to do all those things, but in maturity, I realized I didn't need to leave at all. I mean, it's good to have a headquarters and a home base, and then travel. But like, if I could have stayed closer to my family and also stayed closer to my wife's family, we would have a much more rich life with our kids and with everyone there. And it could get bad, people are. But
What's the saying? There's the family you're born into.
Yeah.
And there's the family you choose.
Yeah.
Right?
Well, I would choose my family that I was born to.
But and they can be both. They can be. It doesn't have to be an or.
Yeah. Right.
So
it's definitely an and.
Yeah, it's an and. We have built an amazing community for ourselves and our family here. My kids have accessory grandparents. Whatever. They've got. We've got multi-generation. Age engagement, and always have, and then and we travel to go see my family. We travel to go see Mark's family. I don't necessarily know or expect my kids to come back and live their adult life here, and that's okay.
Yeah.
There was never any expectation from me that I was going to return to the town that I graduated high school in. There was never an expectation from Mark that he was going to return to the town that he grew up in. So I think part of family is also going, what's right for you as you're growing and developing into your own person.
Well, a lot of our friends here, and it is Black Mountain, and so you need to explain how quickly people want to move here. But our friends, like I said earlier, they move here and they have kids. Well, their parents move here.
Yeah.
And so rather than the kids moving back home, they plant themselves somewhere that's nice for them. And then the grandparents are just sort of like, well, let's just kind of put a second home here or move here all together.
Or move here all together. And I think that's and I don't know if that's unique to this area or if that's becoming U.S. culture.
Well, there's a draw.
But there definitely is a draw to the area. Absolutely. Yeah. And so there's not a right way. I think you just got to be true to one, what emotionally and culturally is right for you and your family. And two, there's got to be financial viability.
Yeah.
And Black Mountain's not cheap.
No,
so
none of it's cheap.
Yeah. So for you to choose to be here and raise a family here, that financially is hard.
I mean, and we felt the pinch during the summer. We're doing a lot better now, but you could definitely tell. And I think it had something to do with Helene, just like the way things went down. Like in that summer after Helene, everything got really tight, and everybody. I think a lot of people were feeling the pinch, not just us. And so, because we witnessed some of our friends decide to move on down the mountain some.
Right.
They're still nearby, but they found themselves in Marion or
Old Fort
Yeah,
right.
right.
There are people that are trying to still be active and feel this community, but they have to live just outside of it. Yeah.
And many of them, it wasn't even a financial decision for them. I mean, I guess maybe at the end of the day it was because they got a lot more land.
Yeah.
And so they're probably living within the same means now, but they're sitting on 5 acres, not
Right.
0.5.
And that's a different lifestyle. And if that's the kind of lifestyle that you want, that's great.
Yeah.
Some people like living in an urban setting. Some people want a more rural setting. So thank goodness they have that choice.
Yeah. What was the other question you were looking at?
Other question. Oh, this one. If you could go back in time.
Let me ask it. If you could go back in time and give yourself advice when you were young, what would you tell yourself?
I would tell myself to spend more time outside of my comfort zone.
Yeah. And before you get into
Yeah.
that, what is your comfort zone? Where does that live?
My comfort zone intellectually is sciences.
Yeah.
I am not a creative person. I'm not an arty person. I loved when my kids were little and I could farm them out for play dates and they did arts and crafts at the play date and we didn't have to figure that out in my house.
Yeah.
I'm not an arts and craft person. So there's the intellectual comfort zone, right? And in terms of the activity type comfort zone, I would much rather be golfing or walking or on my paddleboard. I grew up as a golfer, but golf is not a sport for a working mom.
Are you a lefty or a righty?
I'm a righty.
All right.
But I have not golfed in a number of years because it's really hard to take that amount of time out of your day when you're a working parent.
So the trick, you learned this from the old male boomers. You got to make it work as a business. They go meet and then they talk and they do business.
Yeah. How do you do that as a physician?
I mean, there are ways. There are a lot of old men that are doctors that do the golfing thing and make connections.
They did. So I'm not as good as golf as I should be, so I'm finding other passions. So I paddleboard.
I'd love to go golfing with you.
Okay.
I have my dad's clubs.
All right.
We'll talk about it.
We can do that.
You paddleboard, what else?
And I walk, like fitness walk. Yeah. And yeah.
This is a weird question. When you moved here from, the flats of St. Paul,
Yes.
did you find yourself with any rare foot injuries coming here in the hills? Did you find yourself dealing with some issues?
No.
Okay.
No, we didn't. But again, I'm not
No plantar fascia, nothing weird?
No, but
A lot of people get injured here.
Yeah, but we weren't going for 15-mile hikes.
Yeah.
My husband and my kids camp. I'm not a camper. So again, I wasn't putting myself in those types of activities or environments to risk that kind of injury.
Sure.
And I'm still cautious with my knees. I blew both knees my freshman year of high school.
Oh, were you running track or?
No, I'm hypermobile, so I'm extra bendy, extra flexible.
Oh, can you do the finger thing?
Almost, yeah. And so I stepped down and locked my knee back, and my knee gave out. And that was 4 weeks before my freshman year of high school. So I got that one fixed and was in recovery. And at that point, they kept you immobilized for a few weeks after surgery. And so I was a week, 5 days out of out of my immobilizer and getting my knee back. And I was in the conga line dancing to the Miami Sound Machine at a dance at the county fairgrounds, and I blew the other knee.
So how do you feel when you hear Miami Sound Machine come on? What happens to you?
I'm torn between wanting to get in the conga line and sitting down. Yeah.
That's so funny.
So I was the high school cheerleader with 2 knee braces.
Yeah. Oh, here's a funny one.
Yeah.
Okay, so one thing that led to my dad's early death, he was that kid in the braces in his leg. He had braces on his legs like Forrest Gump.
Yeah.
He had to wear those as a kid.
Sure.
Now, we live in a modern era,
Right.
and that still happens to kids. I don't know what that's
No.
called, right?
So
What's that? What is that? It's an illness or a disease that comes on?
So some kids will have it's malalignment, and so they're either
The spine's crooked, or
well, the spine is scoliosis.
Oh, okay.
But if you're looking at it at the legs, sometimes it's your thigh bone, your femur. It will kind of rotate as you're growing, and other times it's actually your lower leg bones that will rotate as you're growing, and so it messes up the alignment between the hip and the knee and the ankle.
So back then, they'd put you in these big, thick plastic braces.
Yeah, we don't do that anymore.
What do they do now?
So we know now that it's a growth or a developmental thing, and sometimes it fixes itself, and sometimes you need more of a surgical intervention to derotate the bone.
Oh, okay.
Yeah.
So my dad would take his braces off, and then he would raise kids in the neighborhood, and he was the fastest kid in the neighborhood, even with the issue. But later in life, when he was about my age, he had to have his first hip replacement, and then he had that for 10 years. I got rough with him in the ocean one day, and I tackled him from behind, and I broke his hip.
Oh no!
And he had to have his second hip replacement.
Oh no!
3 months after that.
Yeah.
And then I don't know if he ever had a third, but he did have a knee issue.
Yeah.
But that was all in part because of his issues when he was young.
Right. And so that's musculoskeletal growth, and some of it's a just developmental variant. And we know a lot more now about how kids' bones grow.
Yeah.
And the variation of normal and what needs some support at what age.
Yeah.
Because
think it
kids' bones are totally different than adult bones.
Started for him around 9.
Yeah. So it's all so it's just that's a beautiful thing about kids is it's a process, and it's a developmental thing, and some of it you watch, and some of it needs some support, and some of it it's okay.
So, but they don't put him in braces anymore? There's none of that going on?
Pretty uncommon.
Man, all the way up until I was in high school, I remember seeing there was a kid in my school who had that, and I would notice it because I knew my dad had that.
Yeah.
I'm like, he's got what my dad had.
And if you're seeing somebody who's
that was
in
like the 90s.
Yeah, so if you're seeing somebody who's in a support now,
I haven't in a long time.
yeah. I mean, so again, the reason for it may be different. Just like we don't for kids that in tow, they're
In tow?
like they're pigeon toed, their toes go in. Though they're actually fast sprinters, by the way. If you look at the Olympic sprinters, most of them are naturally in toed.
Yeah.
Yeah. And so we've learned that there's a variety of what's normal, and sometimes you don't have to intervene.
Back in the day, would people just intervene and they would be like, "Oh, well, that's an abnormal foot placement," and they would just try to. It's like wearing braces or something, like for your teeth. Looks like they're trying to straighten out your legs.
So again, I think that's what they were trying to do, and we may have better reasons for it now. And braces for teeth is a whole different topic. It's really not about having straight teeth.
Your husband might listen to this and be like, "That guy's an idiot."
No, braces. So, and braces are not just general dentistry. They're actually a huge part of pediatric medicine.
Yeah.
Because
there is definitely a correlation there because it happens in your youth.
Well, and so for a lot of kids, actually for kids who snore, braces and broadening out so the roof of your mouth comes down a little bit is actually an effective intervention for helping reduce snoring.
How do you and your husband intermingle as professionals? Because he's the braces guy. He's not the orthodontist, but he is a dentist.
He's a general dentist. So he does predominantly adult medicine.
Yeah.
He will see some kids, but he is predominantly takes care of adults.
But did you have any overlap with him in your careers together?
We started dating when he was in his second year of dental school. So I was in my year in between working in the research lab, and he was in his second year of dental school. So the summer he graduated dental school, I transitioned into my third year of med school, which was the clinical rotations, and that's the summer we got married. And so our first, so that's 2 years, 4, 8, 2 years, 6. So our first 9 years together, we were doing basically, one of us was doing graduate school, doctor, physician training.
Yeah.
Yeah.
That's pretty great.
Yeah.
Okay. So we are getting close to the end, but I want to ask you, all right, are there any projects you're working towards with Sourwood that you'd like to talk about now? Is there anything specific, any side quests with Sourwood, anything going on that you think you might want to bring to the top of the table?
My big part right now is just telling people that I'm open and I'm available and recruiting members. Just getting people aware that this service is available in our community.
There's got to be people who are excited for this.
When I tell somebody about it, or they're excited and they go, "Oh my gosh, you're going to do great. That's so needed." But that doesn't mean people are actually enrolling. Yeah.
Take your time. It'll happen.
Right.
You had to have some success at the Sun Tzu event. There were so many people there.
I hope so, but this is also not a fast, for most people, this is not a fast decision.
No.
Right? This is, and it shouldn't be. I mean, particularly for kids, I don't want you making impulse decisions.
Well, do you think that your first niche might actually be special needs children? Because I feel like they might be harder to get to the doctor sometimes.
So I'm very open to that. But again, when you look at the majority of, it depends on what your definition of special needs kid is.
Right.
And
and that's a spectrum.
And that there's a wide variety of children with special health care needs. There's a wide variety of neurodivergent. So there's a wide variety of what you mean with that.
Well, in my take, I didn't mean this, but I'm assuming that children with autism would be very difficult to get into a doctor's office at times. So loud noises, clanking, weird things like that can set them off. In their home environment, you would really be a godsend to come in.
I have been able to do home visits for some kids who are on the autistic spectrum, and it's a beautiful thing to be able to see them in their home environment. Yeah.
Well, and I bet you learn so much too.
Yeah, you do.
Okay, so is there anything that the valley? Is there anything that the valley needs to know about you? Like, how can we help them better understand you and what you do? I'm
not going anywhere.
Nope.
This is my home. I'm not moving. I'm not going anywhere. So if you want somebody who's going to be around for the next 10 plus years to take care of the kids in your family, I'm here. I'm also, I'm volunteering at the Swannanoa Valley Christian Ministry Neighbor Care, the free clinic.
Yeah.
That's another joy. That's soul filling to be able to participate in that.
What do you see over there?
Everything, but families who have are very resource poor and need help, and so I'm available to care for people in a variety of aspects in the valley, and I love that.
Tell people about your range. Like, how far can you go?
So birth, and you can actually do a prenatal consult. Like, I've got, if you're pregnant and you're gonna deliver, and you want to discuss, what the next steps are. So when you're a parent, how does that baby get care? I can do from prenatal, and I usually get kids out of high school and kind of transitioned into what's an adult mindset or a lifestyle, and then I transition them out.
Okay, and as far as your range, as far as like how far you're willing to travel, what's it look like for you in the valley? So you're from Riceville or Ridgecrest, basically.
My goal would be 15 to 20 minutes one way. Outside of that, it's it's not a hard no, but it's going to be a special situation, or look at what I've got over the week, because if I've got to block out a 3-hour time slot to
this area, there's a lot of rural
there is
homes.
Right, and that's why I don't my preference is a 15 to 20 minute commute each way, but that doesn't mean that if you need something and you're a little bit further out, we can't make it work. It may mean that we're not going to do it every visit. There's got to be
Well, and that brings us to your location for now. And does this start in January, or is it already started?
It's open. I'm there.
So you're at Dr. Clive's office.
I am.
What days of the week?
So I'm there Monday through Friday, but I'm there after his office hours.
So
so basically Monday, Tuesday, Wednesdays I'm there after 3. Thursdays I'm there in the afternoon, and then Friday is his emergency care and operations business management day, and so I've got the office to see patients all day Friday.
Oh, wow, very good.
And it might seem weird to go, I'm going to bring my kid to a dental office, but most of what you see, we're sitting
really
in the waiting
same.
room. Like think about what you actually need a traditional clinic office to set up to manage your healthcare for your kid.
I mean, it
there
seems
isn't
fun.
a lot.
And it's a good location to kind of...
And it's easy access, and it's centralized. It's easy to find. And it allows me to control my costs too, because I get to share a facility.
Let me ask you about the other side of the mountain, up Highway 9. Like, how can you help those families there, on into Back Cave and back into Fairview? You had mentioned to me that you do care for those people. How do you handle? Because that's where it gets squirrely. It's the 28711 goes all the way almost to Lake Lure.
Wild, it is.
And they claim that's Black Mountain, and it is on out.
When you look at the amount of the distance that some of those kids have to come to school, and the amount of time they're on a school bus.
Oh my goodness.
And particularly if they're on the second run, because we're double loading school buses right now.
Really?
Oh yeah, that's a whole different conversation. Is the need for school bus drivers, but for Owen, there are kids for afternoon school runs on the bus. They have to do one run. They've got kids waiting at the school. They come back and they do a second run.
Some of the people who live out there are eccentric. I recently have met a few people, and there's a large population of Russians out there, and you're like, where are y'all hiding from? It's like they're oligarchs or something, It's like they're trying to get away from something, but they're way on out there, and they're very recluse, and and they're living their life. They're having kids, and it's not like they're going there to die. Right. They're living, and it's a beautiful thing. And I just wonder, that's like its own community. Like, how do we help reach them? Because they're coming to our Ingalls. They're coming in here to see people like you,
right? Again, it's what are their needs? What resources do they feel like they're lacking? It's not for me to judge. No. You need this. It's for me to go, this is available. Yeah. And so it's more about raising awareness of an opportunity or a service, and making it accessible if they need it.
Well, I think that you're going to find that a lot of people do reach out to you here soon, just based on the fact that you're here, and you kind of are holding a monopoly on it a bit because there's no one else, and I think that you're a really good fit. So we've lived in the community since the summer of 2011, and I've worked. I've been a pediatrician in Western North Carolina that whole time. Oh. You just haven't seen me in Black Mountain. Right.
So I, whether it's empty nesting crisis with my kids moving to school, it's also post Helene, wanting to be present for the community.
Yes.
And tired of commuting as the drive into certain areas of Asheville or Hendersonville get trickier. So I'm so happy and appreciative and content about being able to be here.
Well, my wife is making that drive to Hendersonville now. She's at Advent. Not much. She's training this week, so she's there every day. But I don't like that drive. I think it's a long drive. I think when 26 gets congested, it's a super long drive.
So I never drove 26.
How do you get there?
I would go. In the morning, I would go down Sweeten Creek and then finish up on 25. Or if it's the right season, take the Parkway.
Always. I always take the Parkway.
Yep. In the afternoon, I would come home straight up 25 or over on Cane Creek.
Yeah.
Yeah.
That's wise words right there. Listen, people. You got getting around Buncombe County isn't easy.
It's not easy, and you got to pay attention to road closures and the weather and all kinds of stuff. But it's also it can be a beautiful way of decompressing. Also, like my radio was off, it was quiet, and I was just enjoying the country that we live in.
That alone time.
Yeah.
I really like that. I'm gonna peruse these questions one last time.
Please do.
We're at 11:41. We can just hang out if you want.
Whatever you want, man.
Here we go. I want to pull a question here, and I do have another list of questions, but it gets us into deep water with politics and stuff. I'm going to leave it alone. Okay. All right. What keeps you up at night?
Ooh, yeah. I saw that one.
I forgot about that question.
Okay. So, it's funny. We call it, because my husband's brain gets active at night too. And so we call it, the hamster wheel, or the hamster was running last night.
I'm running on like 4 hours of sleep.
Yeah. Oh my gosh.
From
no.
that.
Okay.
No, I'm not mad at. I'm not saying I'm tired. I'm saying like I sometimes can't sleep.
Ooh, I love my sleep. And there's really good science behind the importance of sleep, and particularly for kids, the importance of sleep and routine. Anyway, so what keeps me up at night? It varies on the day. Sometimes it's the next day's to-do list, right? Mm-hmm. And which I'm getting much better about, writing it down. And so then my brain can release it. So sometimes it's worrying about a kid that I saw, one of my patients, and going, okay, we did this, and should I call him tomorrow? Am I, when do I need to check in on them again? Was that the right decision? Did they actually get the medicine? That kind of stuff.
You think that sometimes that's ESP?
No, because usually when I call them the next day, they're fine.
Oh, okay.
It was all me. They're like, Doc, why are you calling me? We're good.
Oh, okay.
Yeah.
I would worry that like you would have this like feeling like she's up coughing, or you'd have a feeling that they were uncomfortable.
No, usually
the nights are the worst.
Yeah,
when you're.
Usually they're like, nope, we're good. We're okay.
That's good.
There's depending on this. Moving my kids to college, there's definitely some, oh my gosh, are they okay? And they are. They're totally fine. They're
probably thriving at this point.
They are thriving at this point.
They're at the end of their first semester.
They're end of their first semester. Yep. They're, family. My parents are in their late 70s. Mark's parents are in their early 80s, and none of them live close. Right. And so, but we are the healthcare professionals in the family. So helping people navigate their own healthcare when they don't live near you, that can keep you up at night.
Yes. And where are your in-laws and your own parents?
My parents currently live in California, about 2 hours away from my sister.
And what part of Cali is that?
My parents are in Palm Desert.
Okay.
Palm Spring, Palm Desert. My sister's in LA.
Okay, so let me ask you about this question with the desert.
Yeah.
I don't know if I told you, but my Uncle James, they lived in Memphis, and he was having respiratory issues over and over again. Mm-hmm. And he was a doctor his whole life, a very good doctor, by the way. And he uprooted the entire family, and all like 18 of them moved out to Goodyear, Arizona, and he lived another decade. But he was looking at like maybe a 3 or 4 year life expectancy living in Memphis. Moving to the desert as an elderly person seems like it might be a wise decision. Is there something to that?
Dude, that's geriatric medicine. I'm a pediatrician.
Okay. Sorry. But you do have...
Outside of my wheelhouse.
Did they make that decision? Because if you're a doctor, I get the impression that runs in the family. You might be in a family of doctors who are really wise to stuff like that.
I'm not in a family of doctors. They didn't like the humidity, and my dad actually is a complex congenital heart disease survivor. My dad's got a one-of-a-kind heart, which I didn't know until after I had finished my pediatric training. So he doesn't do well at elevation.
Oh, like up here?
Yeah. Yep. And so,
I can see how that would be an
sea
issue.
level and a drier climate is better for them.
Yeah.
Yeah.
Very dry. Palm Desert, right?
Yeah.
So,
yeah.
Yeah. And where are your in-laws? You said that-
So Mark's family image is still in northern Minnesota.
Okay. And they never left. You told me that earlier.
Yeah.
Okay. Very cool. You're blessed to have everyone still around.
We are. Yeah. That's amazing.
My family is dropping like flies.
Yeah.
I worry about my own life sometimes. I think I might not live as long as my dad did. I worry about it,
Yeah.
Because you got kids and they're young and you want them to know you.
You do.
And that's the scary thing.
Right.
All of a sudden, like when you have kids, all these new fears, not just about their lives come into play, but you're like, God, how do I keep myself healthy?
Yes. Which means you take care of your own health and self-care, right?
Yeah. Well, I didn't go to the gym today because of our podcast. I guess I'll try to get it in after we leave here.
Drink your water, get your sleep.
Yeah. What's more important, sleep or exercise?
They're totally different. They're both important, but they're totally different.
If I'm running on 4 hours of sleep, should I just go to the gym and just tough it out, or should I try to lay back down?
What kind of risks are you putting yourself? Depends on what you're doing at the gym, and what type of risks are you putting yourself. If you're running on 4 hours of sleep, are you going to get hurt?
Yeah. Well, see, and that's the thing.
Because you're tired.
Some
right?
weird injury that takes you 6 months to get back from.
Exactly. So, but if if my bigger question is, if you're running on 4 hours of sleep, what's going on that you only got 4 hours of sleep?
Well, a 3-year-old and an 8-year-old probably are the main reasons.
And then what's going on and why they're not sleeping?
Yeah. Well, sometimes they are sleeping. I'm just sitting there wide awake because I can't sleep.
Yeah.
And that's just part of, I think, being a dad, worrying about stuff. And
it can be, yeah.
Thinking about work.
Right. And I think, again, there's a concept called sleep hygiene. And so what are you doing in the evening to promote yourself entering into a healthy sleep phase?
And like last night, like I couldn't stop reeling. We had just come off that court mediation, and I mean, my mind was going a mile a minute.
You got it. And so there's nights where your adrenaline's up and your brain's just going, and
I took a hot shower, and then it was like 30 minutes later I passed out. But it was 1 p.m. or 1 a.m. when I finally got to sleep. So it is what it is.
Yeah.
Okay, I'm gonna check one last time. Did you? I don't think I gave you this question. Okay. What advice might you give someone getting into your line of work?
Oh, you did give me that. Okay.
Well, I didn't ask it yet, though.
Okay. So first of all, this is a life. It's a calling. This is not a job and not a career. This is a life and it's a calling.
Yeah.
If you are choosing to become a physician, you are working nights, you are working weekends, you are working holidays, you are missing birthdays, you are missing anniversaries, you are missing school events.
Baseball games, softball games, soccer games.
Yes. And being intentional about, and you may not know this when you're 22, right?
No,
What do I want my adult lifestyle to look like? You may not know that. I think you need to know that you are going to, if you go straight through, you're going to be 29 to 30 when you're walking out for your first real job.
It's a long time to wait.
That's a long time. That's a long time of deferred income.
Yeah.
And and for most people, that's a lot of debt accrual. So the average person now, because you've got undergraduate and then you've got medical school costs, so they're walking out with $250,000 or more in debt. Mm-hmm. So
how long does it take to work that off?
I'm still paying mine.
Yeah, that's tough, man.
Yeah. So you have to go, what is it about it that this is what I want for my own intellectual satisfaction, how I want to live my life, how I want to show up for people. You need to have a pretty good sense of self to go after this.
Yeah, I think so.
Yeah. Yeah.
What are your hopes and dreams for your family?
That they continue to have a strong sense of self and purpose, that they're happy, that they're safe.
That's your kids. What about your husband?
Same thing. He loves what he does. Oh my gosh. He loves being a dentist. Yeah. And so I think for dreams, we've already got it. Like, we're here. We're living it.
Yeah.
We're doing what we love to do. We're in a community that we are so thankful to be in and be a part of. We're safe right now. We're healthy. Yeah, we're good.
Do you ever have wild dreams, like in your sleep? I asked you about your dreams for your family, but do you ever like vividly dream?
I'm not a huge dreamer.
Well, you said you're not like you don't really get a lot of creative. You're not into the creative stuff.
Right.
But I don't think that's all just associated with dreaming. I think a lot of people can dream. I was just wondering if you ever have any dreams where you're like caring for people, or if you ever have anything very telling about yourself, and you're like, wow, I have to meditate on that for a minute. I'm just being a little cuckoo here. We got a little bit of time left.
You know what? That's not how my brain works.
Yeah. Yeah. What is it? What's your brain? How does it work? What's it really do?
I'm good at sleep, and I think actually, to be a physician, you need to be good at sleep, because for going through training, there's a lot of times where you don't get a lot of sleep or not consistent sleep.
Yeah.
So you gotta be able to fall asleep and sleep hard when you can.
Yeah.
My husband laughs because we get on an airplane if we're going to travel somewhere, and we haven't even taken off, and I'm asleep, and I'm sitting straight up, and I'm just asleep.
That's great. Where do you like to go if you go on vacation?
So again, a lot of times we're going to see family because our family doesn't live close.
Do you ever go anywhere
fun?
Yeah.
That's not family?
Yeah. Yeah. Do you have special places that you guys like to go? Or?
Oh, gee whiz. We love the water. Mm-hmm. So places with water are great.
You know, I saw there were flights to Key West for $89.
Wow.
Yeah, I think it was one way.
Yeah.
But still.
Yeah.
Yeah. And that's an hour and a half flight.
That's an hour and a half flight. We have had the privilege of being able to go to the Caribbean a couple of times and really enjoyed that. Mm-hmm. We had, for my parents' 50th wedding anniversary, this was pre-COVID, so 2019, I think, my sister and I put together, they wanted to do Italy, and so we put together a family trip, and we did a variety of stuff through Italy, and that was really special.
My wife wants to buy a house there. She keeps seeing these things where they say you can, like, they'll pay you to buy a house. I wonder if that's true.
Yeah. So I think, but the flip side is we live in such a fantastic area that it's also hard to go when it's our free time and we're going to go play. Like, why do we want to leave where we are?
Yeah.
Yeah.
That's been us too.
Yeah.
We go down to the pond at Tomahawk and just sort of hang out,
Yeah.
you know.
Go walk around there. I'll go to Lake James and I'll paddleboard. And yeah.
You're right. It is a pond, though.
It's a pond. You can walk around it. You can yes, I'm sorry for people. When you come up from the upper Midwest, and I spent 21 years in Minnesota, land of 10,000 lakes.
So
it's a pond.
I have prints on the wall behind me here.
Okay.
Behind you. Have you ever been to Lake Minnetonka?
Yes, I have been to Lake Minnetonka, and actually you have a print of Prince behind you, and so his club in downtown Minneapolis is still alive and running, and my nephew has won the Halloween costume contest there several years.
Oh, really?
Yes.
That's incredible.
Yeah.
Yeah, it's funny. I'm glad I brought that up just as a kind of a fun joke at the end. All right, so for everybody watching at home, this is all part of the Swannanoa Valley Chamber and Trade School Initiative. The reason we brought Nicki in today is because she's part of our, what do we call it? It's not a scholarship. What do we call it?
Community investment grant?
Yeah, it's a community investment grant. Thank you. I forgot the words. But basically what we're doing is any type of service that we see is needed in the Valley, we're reaching out to people who might be able to provide that service, and we're offering grants to them every quarter. So the first quarter of 2026 belongs to Sourwood Pediatrics and Dr. Nicki Groves.
Thank you.
And so you're going to be seeing a lot more of Nicki as we enter into the new year, and I cannot wait to start showing you guys what she's all about. So I just want to say thank you for coming on the show. We're going to do it again, but we're going to do it at the office.
Yes.
And it's going to be very formal. We're going to ask even better questions, I think, then.
Okay.
And maybe we can really dive into some deeper topics, too.
Sure.
But thanks for coming on the show. Shake my hand.
Thank you.
Yeah, cool. I'm Josh Lloyd, and you're on the Ridge, and this is The Swan. Thank you.